We're back now with Dr. Robert Krasowski with Cone Health Heartcare at Asheboro. We're talking a lot about prevention. One thing that a lot of people I know are doing are starting to wear watches and the rings that track their steps and all that stuff. Can that be helpful? Oh, you got it on right now. Why is that so helpful?
It is very helpful. Those devices are really very helpful. First of all, let's talk about what those devices can do and what those devices cannot do. So we can monitor our activity, we can count steps, we can look at our heart rate, we can measure the time that we spend exercising, which is very important. So for example, in my case, my goal is to walk at least 10,000 steps a day. At the end of the day, when I come from work, I'm usually exhausted and I think I was walking probably for 20 miles. Well, I look at the watch, that is not the case. I did only maybe 6,000 steps. So it forced me to get off the couch and do a couple more thousand steps so I get to my 10,000s. Second thing, it can monitor heart rate. So heart rate is important because when you do exercise, you try to keep exercise at decent level. So if you listen to our discussion today, you decided I'm going to start exercising. You go and start walking. Initially, your heart rate will be very fast, let's say 125. But if you start doing this on a regular basis, your heart rate will be slower. And that will be the time to push a little bit harder. Simply, you're getting in better shape. That's why your heart rate doesn't go that fast. Another important thing, those devices can monitor some arrhythmia. I'm thinking especially about atrial fibrillation, which is very bad arrhythmia that can lead to stroke. So those devices can pick it up. Can also pick up some slow heart rate and fast heart as well. So for example, you probably, and I hope you didn't notice at the beginning of this conversation, my watch started beeping because my heart rate was unusually high. Of course, this device can see what's happening. I'm not running, my heart rate is fast, so it alarmed me. Of course, this device is smart, but not smart enough to realize that I'm doing live interview, which of course make me nervous. Another thing what those devices can do can also sometimes measure blood pressure. It's not a diagnosis of blood pressure, but give us some idea that maybe somebody have high blood pressure. What those devices cannot do, it cannot detect heart attack, it cannot look at risk factors, cannot check cholesterol. So clearly beneficial, motivational device, but still have some limitations. So we need to be aware of that.
Well, no need to be nervous. You're really great at this, giving us lots of good information. You know, speaking of heart racing, that's one of the signs we should look for. What else should we look for when it's time to call 911 or go to the ER?
Yes. Yeah, that's a very good question because we were talking about prevention, which is fundamental. But please do not ignore, do not wait too long when you start having problems or symptoms that are worrisome. What are the symptoms? Signs and symptoms of heart attack will be pressure, burning, tightness, squeezing in the middle of the chest, sometimes radiation to the jaw, sometimes radiation to the ear, sometimes radiation to the arm, started usually kind of abruptly, lasting for a few minutes, especially if you have shortness of breath with this, or if you're sweating, if you have dizziness or palpitation, do not wait. Call 911. The sooner you get to us, the better we will be able to save sometimes your life. We didn't talk about stroke, but it's important to also realize this. Signs of stroke is I'm not able to talk, I'm not able to understand, my mouth is dripping, my one side of the body is not functioning, I cannot move, I cannot feel. Again, the reason why I'm mentioning this, it's critically essential come to us early. If you come to us early, we can do a lot of things and save your brain or your heart.
Well, out of everything we talked about today, what do you think is the most important takeaway for people?
There are a few things that are very important. One point I want to stress, internet is an excellent source of information, but we need to be selective. We need to make right choices what we're reading. So if you're looking for information on the internet, please look at reputable sources. Look, American College of Cardiology, American Heart Association, Cleveland Clinic, Mayo Clinic. Some of celebrities may have opinion about cholesterol, but they are not expert. Please look at reputable sources. Now remember, try to eat right, try to exercise, get off that couch. Important point, come to your doctor, let us to evaluate you for any risk factors that you have, because the earlier we start treating this, the better outcome will be.
Well, thank you, sir, for being here. We always appreciate it. This will all be up on WFMYnews2.com later today if you want to share it with family and friends.